At the turn of the decade, the economic downturn had entered full swing. The optimism of the millennium had begun to fade. Though fundraising efforts were more difficult now, the work of the society was going to prove more important than ever before. Between the ageing population, the slimmer public service, and lower expendable income, the number of family carers had increased by almost 14% in 2011 from their 2002 level. By April 2011, as much as 4% of the population was providing unpaid assistance to others, with the average carer giving 33 hours per week. Many of them were caring for family members with Alzheimer's disease, and of those, many still were going to need support, advice and training. Paradoxically, the society would need to expand in this time of shrinkage.
The work of dementia advocates and awareness campaigns was also important during this time, as they fought to keep people with the condition foremost in the concerns of both the public and policymakers. This period saw the first dementia ambassador, who represented Ireland at the meeting of European Dementia Working Group in Glasgow in 2012. Soon after the first meeting of the Irish Dementia Working Group was held in February 2013, a group designed to enable and encourage people with the condition to lobby policymakers and other stakeholders. In December of the same year was the first meeting of the Dementia Carers Campaign Network, a similar group of advocates raising the concerns of dementia carers. Because of this, dementia awareness made great strides in this period. Advocates from the Irish Dementia Working Group, like Kathy Ryan, are on the forefront of this campaign. She was the first person with dementia to appear on The Late Late Show and is still speaking and appearing at countless events.
Finally, the call made in the manifesto in 2007 was heard, and the Alzheimer Society helped negotiate Ireland's first national dementia strategy, a document made in collaboration with the government to set up a list of priorities for people with dementia. The list of priorities includes better awareness and understanding of dementia, development of materials for GPs to have faster and clearer ways to diagnose the condition, and clear responsibility for dementia assigned to a senior member of the HSE. The implementation of this strategy is still unfolding, and the Society continues to work with the government to help make the strategy a reality.
October 2016 was also a red letter month for advocates. It was the first month in which videos from ASI were viewed over 1 million times. This marks the Society's adoption of social media and the effectiveness with which our message can be spread across such platforms. It also marked the formation of the All-Party Oireachtas Group on Dementia, which would help ensure that through future governments, people with dementia would continue to have some influence on policymakers. As Kathy Ryan once said, dementia diagnosis isn't for the person, it's for the whole family. So in July 2017, the De-Stress Report on Family Carers with Dementia was released. The results of the survey were of stark concern, but the study's implementation was important in itself. It was the first time a large-scale study had been conducted into the mental health and well-being of spousal dementia carers in Ireland. The stress of family dementia care, long held as a common knowledge to dementia advocates, finally had a surveyed mathematical reality to it. Which brings us to the present day of the Society, and so the future. What does the future hold for the people with the condition, their families, and us, their supporters? Few things of certainty, and more hard work, of course, but we can look back on what we have done to date with pride.
And I'm delighted that 35 years on, the Alzheimer Society is now a national organisation who, together with dedicated volunteers and staff, is providing support and services and care and continuing to advocate for the 55,000 people living with dementia in Ireland.